start if you just tell us who you are and where you're from and what you're doing.
Well, my name is Davies and I'm a Yamatji man from the central part of Western Australia, which takes in the Gascoyne, Murchison and Midwest regions, which is from Carnarvon to the north, Geraldton, Dongra to the south, and out to the Meekatharras and Sandstones to the east, to the remote areas. I'm the chairperson of the Aboriginal Medical Service in Geraldton and have been involved with that service since the beginning of time and involved with many organisations. 10 years as the chairperson of the Yamatji Regional Council for ATSIC in the ATSIC days. I've spent 3 years as the chairperson of the West Australian Aboriginal Legal Service, and the list goes on. The government's decision and the cuts that they're making and the conditions that they're putting on Aboriginal people to receive funding in this country now is going to have a terrible impact on Aboriginal people who live in remote areas and lived in those remote communities forever. They've never lived anywhere else, their families have never lived anywhere else. Nobody in government has been out to talk to them. No government service providers have been out to talk to them. They don't have access to the same media and information that Aboriginal people in the cities and big towns do. So they don't really know what is happening until somebody rocks up with a piece of paper for us to sign and say, this is going to be your funding and these are the programs you're going to. That is what we call inequity. We want people, we want government to engage with our remote communities, and there are thousands of Aboriginal people living in remote communities in Western Australia. We want government to engage with them face to face on a one-on-one basis so they can have an input to what they see as their priorities for themselves, for their communities, for their children, for their education, for their employment. It is absolutely disgraceful that the government of this country has totally ignored Aboriginal people in remote Western Australia. And we call on Tony Abbott and his government to go out and engage with Aboriginal people. Not do what Nigel Scullion and Warren Mundine did. Come to Yamatji country, do what they had to do and leave and not engage with Aboriginal people. We were so insulted by the disrespect shown to us by those two people that we decided we would travel 3,500 kilometres to come here and give them the opportunity to engage with us where they feel most comfortable, because obviously they were afraid to engage with us in our own country. We have mental health issues is a #1 priority no matter where you go in this country. Mental health is an absolute priority. 400 suicides in the last 3 years around Australia.
Specifically in health, what would you like to see from the government? You mentioned you'd like to see more community control services.
Absolutely. The fact is that in Aboriginal community control services, we employ more Aboriginal people than any other government or non-government service provider in this country. We train more Aboriginal people than any other government or non-government service provider in the country. We have a larger Aboriginal client base, collectively, the 150 Aboriginal medical services, than any other government or non-government service provider in this country. We are doing in the Aboriginal health sector exactly what Warren Mundine and Nigel Scullion are saying. We employ people, we educate people, we train people. We are the people who should be engaging. And if you have a look in the AMSs, where it's 80% plus in every service about the number of Aboriginal people who utilise Aboriginal medical services, and if not, because governments won't do it. But the fact, if you have a look at the health of Aboriginal people and the services that they get compared to where there are no Aboriginal services, there is a marked difference. So if this government and the state governments are serious about closing the gap on Aboriginal people, two things will happen. We will continue to establish more Aboriginal controlled health services, and if we want to close the gap in this country, we must take the health services to the remote areas for Aboriginal, because at the moment where they don't, in remote areas where they don't have Aboriginal community control services, they have to travel thousands of kilometres to get to health services. And more times than not, the Aboriginal people in those communities don't attend services until they've gone past the point of no return.
So how many more do you think we need? How many more community
Well,
services? Has anyone scoped that to say?
We haven't, but I believe that if you have a look at what the current 150 deliver around this country with the support of their state affiliates and of course the national NACHO, which is one of the best health structures in this country, Aboriginal structures in this country we've ever had, from NACHO at a national level down to the state affiliates to the services, another 150 would go a long way to closing the gap on Aboriginal health in this country.